Thank you so much. It's so great to be here with everyone, and I'm excited to see all of you here today virtually. I thought that it would be a great time to have a little bit of discussion about pain in our pets. And before I start, I do want to mention the IVAPM because there's a lot of resources for pet owners on our website. As well as just letting you know that we do have resources for your veterinarian as well if you if you find that they might be interested in learning more about animal pain and identifying and treating it. So you probably are wondering why I'm here. My life as a small animal veterinarian, my practice life seemed to improve a lot. Somewhere when I was practicing for about 10 years, I seemed to find that I was really doing a better job as a veterinarian if I was able to identify and reduce or eliminate my patient's pain. And that really changed my practice for many, many years. It made me much more successful as a clinician and as a caretaker of your beloved pets. So I thought today we would just do this really simply and talk about 4 pain management lessons that you can take home and help you understand a little bit more about you and your pets. So I'm going to break this down really easily. Number 1, your pets are in pain. And I know this sounds logical, but this is a problem. We have a real education problem in veterinary medicine. And I'm showing you these videos. I'm going to start with cats. So these videos actually come from a YouTube site called Funny Cat Fails or Crazy Cat Fails. And what I find really interesting about these videos is that people think this is funny. This is their cat being dumb or silly or funny. But these are indications that these cats are in pain. These cats are in musculoskeletal pain. And I think that we have trouble identifying that because they're not really coming up to us and tapping us on the shoulder and saying, hey, we hurt. So using this as an identifier and as an educational tool for you as the pet owner to be able to say, hey, maybe my pet is in pain. And in case you were thinking that your dog doesn't do anything that would cause pain, my dog's a couch potato. He doesn't do anything that might make him be painful. He doesn't cry out. Well, this is what most of our dogs do all day. And I think it's, again, a learning tool. Step 1 is that our pain management lesson for today is that our pets are doing things every day that can cause them to be in pain. We could watch these videos forever. They're really cute. We start to, when we first look at them, we identify the breed and we're like, oh my gosh, my dog does that. That's so funny. It's crazy. But let's look a little bit deeper and say that there are things that they're doing every day, all the time, that we just kind of discount, which could be causing them to be in pain. I love this little corgi. He goes splat right across the beach. But again, that's step 1. This is the most important pain management lesson that you have, is that your pets do have pain. Okay, so step 2, relieving pain helps us, them, everybody heal. Um, I think the biggest thing is, again, a misconception that we don't like to take pain medicines. And we sometimes avoid, no, I really don't want to give my dog pain medicines. I know what they do to me and they make me feel all loopy. And I really don't want to do that. I'm not really talking about opioids here. I think that um, that everybody has this concern about giving opioids to themselves. I want to limit that because I don't want to have a chance that I'm going to have some kind of addiction or abuse. There's a lot of other pain medicines and a lot of other non-pharma pain management options that we don't want to decline. Relieving pain is going to help us and our pets heal faster. And I need to explain this to you in really simple terms. There's a lot of consequences to pain, especially if we don't take care of the pain. So there's this what we call vicious cycle. When we have pain, it creates this stress response in our bodies, and that increases ACTH and cortisol, which are the stress hormones. Those in of itself change a whole cascade of hormonal um, problems in our body, increasing the renin, aldosterone, and angiotensin system. You don't have to memorize this at all. Decreases our insulin and our testosterone. That in of itself increases that stress response. Catecholamines are increasing ACTH and cortisol of themselves. So you can see that the consequences of not treating pain causes this cycle to go over and over and over again, which is problematic. And it becomes a lot more complicated. And this chart just shows you how complicated it can be, that pain creates all these problems in and of itself, not really related to the actual disease process or trauma or surgical thing that may have happened. You can have all these things occur. And I kind of break it down simply right here. What happens with uncontrolled pain? Uncontrolled pain will make your immune system not work so well. It slows the healing of injury in your body. So if you have a wound, it's not going to heal as fast if you have pain. Increasing complications or even causing a higher incidence of death after trauma or surgery. Very important. We in the medical world call this morbidity and mortality. Sometimes you'll hear that. That increases in morbidity and mortality occur because we have pain that is not well controlled. We know that pain promotes cancer or tumor growth, which is bad news. We know that it can change our actual muscular locomotion. It can change our respiratory and cardiac function. And pain can unfortunately affect our mental health. It can cause aggression in people and in animals, sleep pattern changes, anxiety, depression. All of these things can occur because of uncontrolled pain. Bad news, right? Um, I I call this a dust study, and it's interesting because this is a study that was very popular in 2014. It came out about 6, 7 years ago, and it was in Cell magazine, which a lot of people read, whether you're in the medical field or not. And the study, it was plastered all over the place that mice that feel less pain live longer. And what they did was these scientists took pain receptors out of mice. And then they realized that the ones that did not have these pain receptors, so they weren't feeling the normal pains of life, they lived a longer life. Great news. That's kind of what I call a duh study. Yeah, if I don't feel pain, I get to live longer. But the more interesting part about this is besides reducing or eliminating the pain in these mice, it wasn't just that they lived longer, it's also that they had a better quality of life. And they measured this in the mice by their grooming, how that they ate, that they maintained their body weight, that they had better muscle tone, that they had better skin condition. So besides living longer, because who wants to live longer if we feel crappy, right? Besides living longer, they lived better and felt better. And this is important. We have to remember this when we're thinking about pain, and realizing that if we are able to do something to reduce our pain, we're going to have better outcomes for sure. So let me take a few minutes here and talk about good pain and bad pain. And there is such a thing as good pain. So good pain, I look at this dog and I say, okay, the dog steps on something and twists its knee or something like that. Or how about, ouch, I burned myself, or ooh, that hurts. And so what happens is this dog then has this response. It's good pain, and it's to any kind of mechanical or chemical or thermal problem, and it causes a withdrawal reflex. So you touch the stove, ouch, I burned myself, or ooh, that hurts. And it causes a withdrawal reflex and says, hey, don't do this again, or you're going to continue to hurt yourself. So that's that basic physiologic or acute pain. But what happens when good pain turns to bad pain, and how does it happen? Well, the issue is that pathologic pain or bad pain or chronic pain, all of them kind of the same thing, they follow that same pathway, but it differs from the good pain because it's persistent. There's persistent tissue injury or inflammation, and our body, our neurologic system, wakes up these C fibers in our spinal cord and in our nerves, and there are chronic pain fibers, and they wake them up, and basically, over time, the body and the brain completely breaks down. It's not just a reflex, it's not just a withdrawal, it's not protective, it becomes bad pain. And it's related to how long it is, how much anxiety, fear, if we're hysterical, if there's stress, if we have history, if we're anxious or thinking that there's a catastrophe, if we're avoiding it, all of these things can create chronic pain or bad pain. And then what happens when we have chronic pain is our nervous system does some crazy things. It sensitizes to the pain. So three things can happen. Our pain response can be exaggerated. So what really wasn't painful before can be really, really, our response to it is much worse. Our pain response can be in places where the original injury didn't happen. That's that secondary hyperalgesia, meaning that, hey, you got hurt on your knee, but now your back hurts and your thigh hurts and your hip hurts and your ankle hurts, and everywhere around the initial injury hurts. And then the third thing is that idea of allodynia, which is really crazy. And some of you who may experience chronic pain know this feeling, that you have an injury and you're painful, but your pain goes on so long that if somebody just touches you with a feather, you react and you feel very, very painful. And all of those things can happen from an acute pain situation not being handled correctly. And the interesting thing is we're basically all the same vertebrates, fish, frogs, the lower vertebrate species up to mammals, mouse, elephant, dolphin, dog, and cat. The responses to pain are based on the following: memory, genetics, and then the variation really comes from having some more evolved inhibitory pathway, and certainly any social and psychological factors that can contribute to the pain response. So what do I mean by this? This is what happens in development of chronic pain. Why do some animals or people have more of a problem with chronic pain than others? Well, there's some factors that cause this. So I show this picture. Why do I show the picture of the redheaded child that's screaming, and the redheaded crazy dog with crazy eyes? What is the difference between these individuals and these individuals? The laid back surfer dude, Spicoli, and the golden retriever compared to the wired husky and the redheaded baby. Well, that's all related to genetics. There definitely is a difference between how we respond to pain and how your dog or cat may respond to pain based on their genetics. So that is a factor that can be a reason why there may be an individual that may progress from acute pain to chronic pain, the genetics. And the problem with this is the difficulty in knowing which animal might have the problem where the acute pain is going to morph into something more chronic. Another factor would be this. Now, you don't have to read all these words, but these pictures show you things. So this is a dog getting its tail docked, a puppy, a couple days old. And this is a calf getting debutted. They take the horns off of baby calves so they don't injure each other as they age. Probably more of you are more familiar with the idea of babies getting circumcised. So the idea that learned behavior can be a reason why we would develop chronic pain is been studied over and over. And all of these situations are similar. I'll go back to the circumcision because I think people are familiar with that. What they did was they looked at babies that got circumcised with and without pain medication. So I hate to say it, but for many, many years, we believed that infants didn't have that developed neurologic system, and the same with animals, that they didn't have this developed neurologic system so that they weren't having a big response to pain. So we could do painful things without providing analgesia or pain medication. And what we found in babies is we had a group of babies that we did circumcision without any pain medication, and we did a group of babies with pain medications, a topical anesthetic and analgesic during circumcision. And what did we find? Well, you guys can probably figure out that we found that the babies that got the analgesia, that got the pain medicine, did better. They didn't cry as much. But more importantly, is the babies that did not get medication during circumcision were the babies that had a much more attenuated response or a much more severe response to vaccination 6 weeks later. So that's an important concept to say that these babies, because they did not have appropriate pain medication for a procedure at a time before, they then develop what we call chronic pain or wind up pain or allodynia or that hyperalgesia when they just got a simple vaccination 6 weeks later. So we have the idea of genetics and learned behavior or history. We call it history sometimes. And then the third is this environmental influence, the idea that the environment, fear, anxiety, and stress can also cause or possibly attenuate the amount of chronic pain that a patient may feel. So think about this when your pet is going to the veterinarian. If they are in a situation like this cat where they are so fearful, could that lead them to have a bigger problem with pain? Well, we've studied this. Here's horses, the effects of stress on pain in horses and incorporating pain scales for equine practice. So the idea of looking at horses and being able to reduce the amount of stress so that they'll feel less pain. And this fear and anxiety is interest. The fear sometimes can cause an inhibition of pain. So think about you when a bear is chasing you in the woods and you're running and you stab your leg on a tree branch and you keep running and running because you don't want that bear to catch you and eat you for dinner. Well, that can inhibit the pain. You don't realize that you have this big puncture wound in your leg until you're done with that fearful thing. So inhibiting pain for short periods. The anxiety, on the other hand, is that anticipation of something bad. So the idea that, oh my God, I hate when they draw blood from me. I hate it. I'm so anxious about it. And it really doesn't hurt that much if you're more relaxed. But if you're anxious about it, oftentimes you'll have an attenuated or a higher pain response. So pain, remembering that pain can cause fear, anxiety, and stress because you're already hurting and you're afraid that you're going to hurt more. But also, fear, anxiety, and stress can cause pain. Anxiety levels may be able to predict how severe the pain may be as well. Interesting thing about this is you as a pet owner can help to reduce pain in your pet by paying attention to fear, anxiety, and stress and doing something about it. Making sure that you use fear-free handling techniques or that your veterinarian or your trainer uses fear-free handling techniques, or using something like the Calmer Canine to be able to reduce the anxiety your pet may feel going to the veterinarian. So relieving pain helps us to heal. Number 3 is measuring pain helps us to fix pain. The whole idea that we need to measure makes so much sense. Divine is the work of sedating pain. This is in Latin, but Galen's back in the 200 AD. Gallon was amazing because he didn't have modern laboratory testings, but so he scrutinized the patients for clues. He was sensitive to those minute changes in body temperature and pulse. He looked at facial expression and skin color of his patients. So he was way ahead of the time. He also interrogated patients with open-ended questions, which are really great. And we do this in veterinary medicine. Your veterinarian is playing Sherlock Holmes' job every time, being able to go through this to get a diagnosis and treatment by observing and doing tests and measurements and data interpretation of that, using their brain to figure out what those observations told them, and then categorizing into what the problem could be, and then coming up with a diagnosis and a plan, therapy being among that. It continues though, because to decide whether what's working is working, we need to do this. Totally a Sherlock Holmes investigative process. And here's our little veterinarian investigator and our cute little corgi, and they're collecting clues all the time. Is the temperature up or down? What does that tell us? Pain, anxiety, infection, stress. If it's down, is it infection, organ disease? What's going on with the pulse? Is it fast or slow? How about the respiration rate? How fast? Is it panting? Is it because he's scared? Is it because he's painful? Is it because he has some kind of cardiac or respiratory disease? We're collecting clues all the time using our senses: see, hear, smell, taste, touch. And we're doing this because if we can't measure it, we can't improve it. And pain belongs there as well, because if we can't measure where we start with pain, we cannot improve it at all. But how do we measure pain? It's really hard. So we certainly have trouble just asking the animal. And you can see from these images that it sometimes is very difficult. All of these animals are exhibiting pain, but just a glance at them, you might think that the bird is sleeping and that the horse just seems tired and that the cow looks normal. So we sometimes have difficulty noticing. And I don't know if any of you have an Irish setter, but sometimes there are certain breeds that make it much more difficult to determine if they're in pain. And of course, with cats, because they don't like to show you anything. So we like to use things like pain scores, and this is what you might see, and I'm sure you've seen it in your own physician's office, these pain scores, the idea that we can measure pain and then we can do a treatment and be able to determine how successful this treatment is. And in your veterinary office, we have our own pain scores that we use. This is a Colorado State one that you'll probably see your veterinarian use quite a bit. Some of them use a number table like this. And we also use things like facial grimace scale. So this is a horse grimace scale, which can be helpful to be able to determine if we have issues with pain. So measuring pain helps us to fix it, because if we don't measure it, we can't fix it. And you can help. Here's number 4, and this is probably the most important for the end of this talk. You can help us see what we don't see. So the issue is that animal patient survival depends upon them hiding pain. And that stress of veterinary visits masks the pain to us. It's very, very difficult. So you as the pet owner need to facilitate or help us identify behaviors that might suggest pain. And some ways that your veterinarian is going to ask you to do this is by filling out questionnaires. So this is what's called the Canine Brief Pain Inventory. It's a validated tool for you to use to be able to tell us specifically how your pet is doing, so we can get some objective data. My dog is walking normally, he walks with stiffness, et cetera, et cetera. Very important for us to be able to evaluate success or failure of a treatment. The cats, we even have better tools. They have www.painfreecats.org. This is at North Carolina State Veterinary hospital, and they developed the feline musculoskeletal pain index. The nice thing about this is you can go on there, you can fill it out before you take your cat to the veterinarian. You can print out a copy and take it, and without any bias, at least amount of bias as possible, you can identify how your pet's pain score is before they're even examined. And then once the veterinarian is prescribing or diagnosing or prescribing a treatment, you can follow up with doing more evaluation at home, which gives us a lot more accuracy into what's going on. The problem with this is that we have shortcoming with our metrics, and the shortcomings are really us, because there's something called a caregiver placebo effect. It could be upwards of maybe 40 to 45%. When we looked at a study of the way that some drugs work in dogs, and then asked owners and also asked veterinarians and veterinary nurses to evaluate, we found that pet owners versus an objective tool of measurement, which is the weight that an animal with arthritis was putting on the ground, there was a placebo effect of almost 40%. Veterinarians are sometimes worse. What this basically means is that all of us have this instinct, and it's probably really accidental, to over-represent how well something is working. Maybe it's working, doc. I really think that this drug is working. So we tend to think that it's working better than it should, which makes taking observations and doing more objective data very important for us to be able to successfully treat your pet. So you'll probably see some veterinarians do things like this. This is thermal imaging to be able to more objectively evaluate response to treatment, as well as to evaluate areas of your pet that might be in pain. And even better, something new called the pain trace, which is being evaluated now to be able to look at neurologic impulses and be able to actually measure pain and see it be relieved by a certain treatment. All kinds of more objective data that we can have to be able to identify if the pet is in pain. But the most important thing, like we said in step 4, is that you can help. And really being aware that your pet is in pain, that there are signs of pain, that that if we treat this pain as best to our ability, that we're going to be able to extend your pet's life and give them better quality of life, no matter what the disease process, and that you are going to be able to be the most helpful to us to be able to identify common signs of pain in your pet and help us be able to evaluate and treat them to the best of our ability. This is a great resource for you to be able to identify pain in your dog or cat. These are available on the International Veterinary Academy of Pain Management website. Again, your veterinarian can give you these tools as well, but the idea that you can use these to be able to look and identify and be much more proactive is only going to be able to help you and your veterinarian treat your pet appropriately.